All right, so this is our advocacy session. I think this is Nathan up here with the National Hemophilia Foundation. We've got our panelists. Y'all know Jeremy, our advocacy consultant, and of course my name is Sue Martin, Executive Director, Hemophilia South Carolina, and my passion is advocacy. And as I talked about earlier, if we're not advocating, who's going to be advocating? So I want to give you just, what happened to our site over here? Mike, are we good over there? Is that okay? Okay, so I'm going to just keep rolling. So this is our advocacy picture. And how come I can't see it? Oh, there we go. So what does advocacy look like at Hemophilia South Carolina? So I want you to see a little bit of it.
Representatives, and we will give them a room round of applause. Please stand and let's welcome you to South Carolina. We're glad to have
Max, how many rare diseases are there? 7,000 different rare diseases affecting 1 in 10 families. That's what advocacy looks like in South Carolina. And if you think that you can't do that, I hope by the time we're done with today, every single one of you will sign up. You have the information in your packets of what our advocacy program looks like, as our ambassadors, and I guarantee you will hear from others. Every single one of you can be involved in advocacy. So in a minute, I'm going to introduce you to Nathan. I'm going to have you, for time's sake, I'm just going to have you look at his profile and his bio. He is just one fabulous guy, coming all the way from Chicago last night to be with us here today. He is so busy. He does so much work with all of us, the National Hemophilia Foundation, Hemophilia Federation of America, all of our government affairs people work so hard with us. They have all made us who we are. You all have made us who we are. We are one strong team. So I thank you for being with us and being a part of this. Jeremy is here. As I said, you're going to hear from Crystal when I pull up Nathan's slides. We have Susie Malloy. She was the ambassador. Raise your hand. Susie Malloy was Ambassador of the Year this year. Christina Evans has been a long-time advocate. April Baird, Ambassador over there. Oh, look at you guys are opposite sides. Ward Keith over there. And Ursula over here. I think that's everybody. So welcome Nathan. Let me go ahead and get his slide up, and I'm going to hand this over to Crystal. Crystal is the chair of our coalition, and I want her to, oh, you already got a mic, so that's cool. I want her to share a little bit about why we advocate.
Okay, I'm Crystal Day, and I just want to just say thank you for everything that you do.
Use the mic. Pull it up.
Okay. I just want to say thank you for everything you do, and I just want to just let you know how important advocacy is and actually how easy it is. We have come a long way. I'm a daughter of a hemophiliac who passed away in the 80s due to the AIDS epidemic, and I see now how far we've come from that moment to now. As my son is 24, just 24 years ago, they said he wouldn't live past 20. So we have really come a long way, and we cannot ever go backwards. And that's why advocacy is so very, very important, and how easy it is. All it is you live with a bleeding disorder every day. You are the person that knows the most about it. So when we're talking to legislators, you are the one that they need to hear from, how it impacts them every single day. How the small things that they would never think about impacts us greatly. And how every aspect of our lives are impacted by a bleeding disorder. And you are their wealth of information. What you say does really impact them. We have built great relationships over the last several years with our lawmakers, and they know who we are. They know that we are a passionate group, that we know our stuff, and all we want is to make our lives better. Just basic needs to be met. They know that they could ask us anything. We have been trained, and it's just so easy. If you meet up with a lawmaker, just tell your story. Hey, I live with a bleeding disorder. This is how it impacts me. And we desperately need to cover the state of South Carolina with ambassadors from every county. We are working really hard to get that done. We have several counties that we don't have representation from, but we're reaching out to those counties, and those of you who live in those counties, we really need you to step forward and help us, and I promise you it's not hard. You are the greatest information person that your lawmaker needs to hear from when it comes to bleeding disorders. So I'm hoping we can teach you during this time how easy it is and how important your voice is. So thank you. Nathan.
Good morning. Good morning. Son, you can hear me? Well, hi, everybody. I just first have to say what a pleasure it is to actually be back in person and to be with the community again. It has been such a long time since I've been able to be with all of you, so this is really a privilege. So thank you for inviting me. Thank you for the opportunity to share some insights about what's going on with advocacy and policy at the federal level and at the state level. I'm going to go through a few slides to just give you a number of updates about what's going on nationally. So, like Sue mentioned, my name is Nathan Schaefer. I'm the Vice President of Public Policy for the National Hemophilia Foundation. I live in Chicago, and it is a real treat to be with all of you this morning. So this is the NHF's newest mission about what we do on behalf of those with bleeding disorders. And as you can tell from the photo, we always like to have a lot of fun whenever we're able to get together with our community members. So I wanted to start with a few thoughts about why advocacy is so important. And this is really piggybacking on what Crystal just said. You are the expert of what your family has experienced living with a bleeding disorder. Policymakers want to hear from those people that they represent about the struggles that they experience. You are an expert in what your family has experienced. You're not an expert in how bills become law. You're not an expert in health policy regulatory reform. That is not your role as an advocate on behalf of those with bleeding disorders. You are there to share your story, your anecdotes, and to be a resource on behalf of those that represent you in many elected offices. You are by far the best advocate on behalf of your community, and trust me, elected officials do want to hear from people that they represent. It is not only your right, frankly, it is your responsibility to speak up on behalf of those that experience similar conditions like your families. It can be a little uncomfortable. I want to acknowledge that. We are here to help ease that comfort and make it more comfortable and more confident for you to go in and share your story. The thing I want to reiterate is you're an expert on what your family has experienced. That's all you need to be an incredibly powerful advocate on behalf of your family and those with bleeding disorders. Be personal. You're not an expert in how bills become law. Who's been to Washington Days? Just show of hands. Even virtually last year. Okay, so we're going to get all of you to participate this coming year. Washington Days is it's our hallmark advocacy opportunity. We usually convene about 500 advocates in Washington, D.C. over the course of 3 days. It's usually in February or March. This past year, it was virtual. And I am sad to say that this coming year, it will also be virtual. We were planning, and it is in your materials, that we were planning to have Washington Days be hosted in person March 9th to the 11th. Unfortunately, we've had to move that to a virtual environment for a few reasons. And it's not just about COVID. There are a lot of safety concerns on Capitol Hill right now. Congressional offices are not taking meetings with large groups of advocates. They aren't right now. Hopefully by March they will be doing so, but we are unable to predict that at this point. And I'm not even going to get into hotel negotiations, whole other headache. But we had to make a call at this point. So we're planning to have a virtual Washington Days experience in late February, early March next year. The nice thing about it being virtual is anybody can participate. We don't have to worry about the cost of travel or hotel rooms. So I hope any of you that have the opportunity to participate elect to do so. We are also exploring the possibility of having an in-person event in Washington in June. It will not be 500 people. It will be much smaller than that. So I'm not sure that we can invite everyone to participate in that. But frankly, we don't even have a hotel confirmed at this point. But we are exploring the possibility of doing something in Washington, D.C. in June. What we will likely do in February or March for our virtual experience, we will focus on appropriations. Appropriations is the D.C. term for money. And there's a lot of federal bleeding disorder programs that require a lot of money on an annual basis. So we'll probably focus on appropriations in March, and then we'll be able to focus more on policy opportunities when we reconvene in June. Fingers crossed, stay tuned. We'll share as much more as we can, as soon as we can. So this is really the overview of NHF's federal policy agenda. We focus on research, surveillance, comprehensive care. We do a lot on behalf of the Hemophilia Treatment Center Network, which I know there's some challenges in South Carolina, which we can certainly talk about. We're always looking to expand our impact there. We're very concerned, continue to be very concerned about blood safety, blood and product safety, and approvals and access to care. These are some of the areas of focus that we center our attention at the federal level. We do a lot with the Center for Medicaid and Medicare Services. I'll talk briefly about implementation of the Hemophilia SNF, Skilled Nursing Facilities Hemophilia Access Act. We continue to be very concerned about ongoing litigation that might impact the Affordable Care Act, which has been in the courts for years at this point. These are some of the other areas of interest at the federal level. There are 2 federal advisory committees that influence blood and product safety. One of them is at the FDA, the other is at the Department of Health and Human Services. They have ongoing meetings, and frankly, there is opportunities for patients to serve on committees that influence blood and product safety. If anybody here or anybody that you might know could be a good patient representative, please let us know. We, I think on a quarterly basis, can nominate patients to actually serve on these federal advisory committees that influence the ways that products are approved, the ways that they're regulated, and have a significant impact on blood and product safety. Last year, we hosted a safety summit, the first of its kind. If you've been paying attention to blood and product safety, there have been a number of product recalls that the community has experienced, mostly in 2019, that prompted the national organizations to convene over 100 representatives from quite a variety of stakeholders. We came to DC for a 3-day conference, and there are quite a number of steps coming out of that safety summit. We are issuing community materials about what you need to know about product safety, what you need to do in the event that a product that your family relies upon has been recalled, how you need to get that information back to your provider, your specialty pharmacy, your HTC, what have you. We're also publishing a journal in a peer-reviewed journal later this year, and there will be a presentation at the World Federation for Hemophilia's Global Summit, which is coming up in November. So we're significantly expanding our network and our impact with safety issues. During COVID, we've been very, very active. We've been trying to implement the MASAC recommendation. MASAC stands for the Medical and Scientific Advisory Committee, which is an internal committee that informs the priorities of the National Hemophilia Foundation. Their recommendation is that all patients should have in their home at least 2 doses of medication. We've only encountered 2 patients that had a problem securing an additional dosage of their medication, but we've been very vigilant about the reality that people need to have things on hand, recognizing that COVID really delayed a lot of people's ability to access the care and the products that they rely upon for their health and their well-being. I'm happy to say, though we were very concerned early on about blood and plasma collection facilities, whether or not they would be deemed essential services and would remain open during the epidemic, and whether or not the people that work there would be provided with sufficient personal protective equipment. Happy to say that has all gone really well. Those facilities have remained open. That said, and I'll talk about this momentarily, plasma donation is down 20% from before COVID. We don't know exactly why. We think it has a lot to do with people's anxiety about going to places, being in close contact with strangers. When you donate plasma, you have to stay there for hours on end. So plasma donation is a real concern right now. So any of you who know people who donate plasma, please encourage them to continue to do so during the epidemic. It is vitally important for the health and well-being of those that rely upon those products. And keep in mind, plasma manufacturing takes 7 to 12 months from when somebody donates to when it actually becomes a product that gets to a patient. So if nobody's donating plasma right now, we're going to have a real problem at Christmas time. And that trend will absolutely continue. So 7 to 12 months. So if people aren't donating now, we've got a real concern. There also were some there were some policy changes that were made during the epidemic. The FDA made a decision that, given the public health reality, they were going to change some of the donor deferral policies. One of them, I won't get into the details, but one of them pertains to men who have sex with men. One of them pertains to those who have had a history of intravenous drug use. All of those time deferrals have been reduced. over the past year. Those announcements were made in April of last year and look to be durable for the foreseeable future, and frankly are consistent with the ways in which other countries have screened people for blood and plasma donation. Happy to answer any questions or talk more about that. There's been an issue with Stimate. I don't know if anybody here relies upon Stimate or knows people who do. It is a nasal spray that is commonly used to treat von Willebrand's disease patients and less frequently those with hemophilia A. The manufacturer of Stimate told us in July of last year that they had to recall the product because there were a number of problems with the manufacturing process, and that they would be unable to redistribute the product in the United States until mid-2023. That was very concerning because a lot of patients rely upon Stimate. Thankfully, we've partnered with the Hemophilia Alliance, the Hemophilia Federation of America, and we found an alternative, which is great news. There is a company, they're based in Colorado, that has been able to produce an alternative that has the similar amount of desmopressin that basically will be an equivalent to Stimate. That's great. Getting things approved and distributed is a whole nother story. So we've had to go about the very arduous task of approaching every single state board of pharmacy to get approval because it's been manufactured in Colorado, so it's out of state for 49 other states. Getting them to approve all of that is going well. We've begun distribution and it's been approved in 31 states to date. So I'm very relieved that we have a viable alternative. It has not been easy, but again, if you've got any questions about that, please let me know. Yeah, sure. And that's a great example of what Crystal was saying and what I was saying at the beginning of this talk. Your realities, your experiences can expedite policy approval processes. That can get drugs back to patients more quickly if you're able to go to policymakers and explain the reality of what it's like to live without a life-saving medication like Stimate. That said, I mean, there are alternatives, don't get me wrong. There are other options that you can pursue. But when you want to talk about quality of life and the ease of access, that can really help policymakers move things along more quickly. So please share your stories. It does have a real world and timely impact on decisions like these. I want to talk briefly about access to skilled nursing facilities. This has been a campaign at the federal level for quite some time for NHF and many of our partners. So I'm not sure who has heard of skilled nursing facilities. I refer to them as like light nursing homes. They're not quite as intense of an inpatient experience, but for our patients with bleeding disorders, often they have been referred to skilled nursing facilities after a surgery or a particularly difficult or cumbersome bleeding episode. The problem is, skilled nursing facilities charge a per diem rate, and they have not been able to build for the cost of clotting factor on top of the daily rate that Medicare reimburses for one's stay in a skilled nursing facility. This has been a problem for our community for many, many years. One of the things we did as part of our advocacy efforts is we surveyed our hemophilia treatment center network and asked, how many people are actually impacted by being referred to a SNF, skilled nursing facility, and being unable to access care. The ATHN data, that's the American Thrombosis and Hemophilia Network, have informed us that about 1,000 people have been impacted by these referrals to SNF. And as you can see on the slide, the final bullet, the number of people that reported accessing difficulty was 92%. That is huge. And again, this was a survey that we did with our network of HTCs. So what happens when people are denied access to care at a skilled nursing facility? Many of them, as you can see, 71% were kept in hospital setting. 61% of them went home and had to access other alternative therapies. And over 50% of people reported that they went home and the family experienced difficulties caring for their loved one in their home. All of those things are incredibly expensive, especially if you're kept in a hospital for any longer than is necessary. So this prompted us to identify a policy solution, which was to allow Medicare, again, this is Medicare reimbursement, to bill separately for the cost of clotting factor on top of the per diem rate of a daily stay in a SNF. There is precedent for doing so. There are some other disease states that have done so, particularly those with cancer, so it wasn't completely out of left field. In order to do this, we tried to identify policy solutions that we could administer from a regulatory perspective, and we were not able to do that. The Centers for Medicaid and Medicare Services said, no, you actually have to change the law. Getting laws passed in DC is not easy at all. 5% of bills that are introduced in Washington actually become law. Most bills that are introduced actually don't intend to become law. Many of them are intended to raise awareness. So when we have a legislative campaign in DC, it is a very tall order. But I'm very, very, very happy to report that last December, this actually became law. It was part of a comprehensive piece of legislation that often helps things get done more expeditiously in Washington, D.C. So now, effective October 1, skilled nursing facilities will be able to care for bleeding disorder patients, which is a huge, huge victory. We're working on communications that we will share with our chapter leaders, with our hemophilia treatment centers, about specifically how all of this works. Whenever you've got a policy change like this, the devil's in the details. So we will help the community make sure that they are able to access what they are legally entitled to at this point. The final point that I'll make on this slide, you can see with the number of people that were identified as legislative champions, we've got bipartisan, frankly, we've got nonpartisan support on Capitol Hill. And that's one of the things that's always been going well for the bleeding disorders community, is that we're able to talk. We don't care if you're a Democrat or Republican or independent. We are here to talk about bleeding disorders and the reality of what our community experiences. And I'm happy to say we had a significant amount of bipartisan support on that initiative. And as you can see, geographic diversity. We've got people from all over the country, which is part of the strengths of our community's impact and our ability to influence federal policy and legislation. Accumulator adjusters. Who's heard of accumulator adjusters? What a complicated issue. Here's the nutshell of accumulators. Your copay card from your manufacturer no longer counts towards your out-of-pocket payment. And this has been really challenging for a lot of community members because our medication is incredibly expensive. So with accumulator adjusters, where they basically reinterpret the way in which your copay card counts towards your out-of-pocket, has meant for many of our patients, they faced bills of like $6,000, $8,000 in February because usually your plan coverage begins with the calendar year. Folks are hitting their out-of-pocket much sooner than they typically would when there is an accumulator adjuster in place. We're almost at the point where we've got federal legislation to address this. And I hope to have more to report on that very soon. If you were at Washington Days last year, this was a key priority. I think it will be again this coming year, because I don't anticipate that bill will be passed by the time we convene in February or March. But we've had a significant amount of support from members of Congress registering their concerns to the President and the administration about this. And at the state level, we've seen legislation introduced, now passed, in 12 states. The one addition to this, those states that are green here have actually passed bills that will ban accumulator adjusters in their state. North Carolina, just this week, actually, the governor just signed the bill, Monday or Tuesday? It was just a few days ago, so I haven't had a chance to update this slide yet. Those slides that are in yellow have currently or have had legislative initiatives towards that end to address accumulator adjusters. And the states that are in gray have not acted on this yet. But as you can see, the number of states that are gray are in the minority. So we've seen a significant amount of activity on this level. So while we're talking about state level advocacy, I have a few other updates. And this is just a map of the country that indicates which of our state government relations team members work with which states. I'm Nathan Schaefer. I'm the blue one on this map. That has nothing to do with my political persuasion. It's just a coincidence. But I get to work with all of you and most of the states on the East Coast. So I'm your point person for anything state advocacy related when it comes up in South Carolina. We're going to update this. There's some changes coming, but I'm going to stick with y'all. I promise.
Yay!
Other than that, I can't. Y'all.
That won't work.
So in terms of state level advocacy, we've had a number of successes this past year. We've seen step therapy legislation passed in a number of states. We've seen accumulator adjuster bills. Like I said, I think it's 12 states, but that also includes Puerto Rico at this point. And we've seen success with rare disease advisory councils. And you all are the most recent state that has been able to accomplish that. Which has not been easy. It has been a very convoluted route to get to this place, but you have done it. You will now have the platform to be able to educate and influence policymakers at an even higher level than you would if you were not able to establish a rare disease council. And getting those things approved by the state and getting them funded is no easy feat. So congratulations. Other states will stand to benefit from your experience here in South Carolina. I actually think we'll see at least 3 more rare disease advisory councils established in the coming year. But South Carolina, and the most recent one before that was West Virginia a few months ago. I'm just looking around for Fernando, who was instrumental in that. I just want to talk briefly about Medicaid and trends that we're seeing in the Medicaid space. And keep in mind, it's now about 30% of our community that accesses their health care through Medicaid. That number has gone up in recent years after passage of the Affordable Care Act that allowed states to expand Medicaid coverage to adults that do not have children. South Carolina is not one of the states that has expanded Medicaid to include adults like that, but I think it's 37 other states that have. I don't think that number has gone up significantly, possibly from 25 to 30%, but this is what I want to reiterate. 30% of the community accesses their care through Medicaid. So what happens in Medicaid is really important for access to care. And the trends that we have seen is that Medicaid offices have implemented in, I think it's 22 states at this point, preferred drug list. That's where they say, These are the medications that you can access without any kind of additional prior authorization or any kind of additional loopholes that you might have to go through to get to a medication. They do that to try and contain cost. And let's be real, clotting factor is very, very expensive. We don't need to pretend that it is not. So we understand when you have a public health insurance program like Medicaid, you need to reduce cost because it's taxpayer dollars, frankly. But where our concern is, well, what if a patient needs access to a product that isn't on this preferred list? How do they get to that? Because patients' health and well-being is what our ultimate concern is. Oftentimes, when they implement these preferred drug lists, they are very non-committal and frankly not as transparent as they possibly could be about how do you get access to a non-preferred product. That's where our advocacy comes into the mix. You haven't had to face this in South Carolina yet. Knock on wood, hopefully you won't. If you do, like I said, we've done this in 22 other states, so we know how to help. Usually there's opportunity for patients to go and provide testimony about why access to care is really important. So in the event that this does come up in South Carolina, we will absolutely help you every step of the way. But what I want you to keep in mind is that a lot of patients access Medicaid, and often they're implementing restrictions on that access to care. And as advocates, that's where we have a role to fill. So in terms of other state advocacy highlights, this past year we had 15 chapters hold state advocacy days. Some of them were in person. Many of them were virtual. Yours was in person. That was the last time that I traveled for work before this week, was when I was here in Columbia. So again, so nice to be back with all of you. I want to talk briefly about the State-Based Advocacy Coalition, or SBAC program. This is a program that NHF operates where we give our chapters an opportunity to apply to NHF for a grant to support state and local advocacy initiatives. South Carolina first became part of that program in 2016, and I have to tell you, candidly and honestly, your advocacy efforts here at the state level are head and shoulders above basically everywhere in the country, honestly. I'm not going to spend a lot of time talking about the Advocacy Ambassador Program because you have local folks here who can speak to how that has gone. But one of the things I will say, and this is really a testament to Sue and Jeremy, they've been very mindful about attracting as many advocates as possible from every corner of the state. When we send out the notice about Washington Days, Sue always says, I got to find at least one person from every 7 congressional districts. As we are expanding the Advocacy Ambassador Program here, we're very mindful that we need representatives from every corner of the state. And I'm just going to explain briefly why that's so important. Many elected officials will not even take a meeting with people unless they confirm that they're actually a constituent. Constituent is another code word for a voter, frankly. That means somebody who lives in their district, who has the opportunity to vote for them to keep that job or vote for someone else who could have that job. Many offices will only take meetings with people who live in their district. I have called to request meetings and people have said, oh, well, who's coming from the district? Oh, really? Well, what's their address? No, that person actually lives across the street from where our district ends. So you have to have, in order to be as successful as possible as a statewide advocacy coalition, you have to have geographic diversity. You have to have representation from as many corners of the state as possible. So if you're not part of the Advocacy Ambassador Program, you're going to hear more about it, and I highly, highly encourage as many people as possible to participate. So far, we have had, this year, we've done training with over 1,500 advocates. Most of that has been virtual, and I'm going to increase that number from 1,500 to however many people I can count in this room when I'm done talking. This is a slide from a poster that we presented last year at a global hemophilia advocacy summit. The thing I want to stress is the map in the upper right-hand corner. All of the states that are shaded the blue color, those are states where we had an advocacy day at the state capitol in 2019. Which is the most valid comparison for what I hope our reality will be like very soon when we could actually do all of these in person. We actually went to 30 state capitals in 2019. And keep in mind, we don't have a chapter in every single state, so I think that that's pretty impressive, though I would love to see us get all the way to 50, but it's a work in progress. We will get there. The final few slides that I have up here are just images of state advocacy days. I think you're all familiar with the Red Tie campaign and the awareness that is associated with that. This is an image from here in South Carolina from a couple of years ago. I just want to share you're not alone in the way that you go to the Capitol and the way that the community is represented. This one's in Colorado. This one actually is in Wisconsin. Here is an image from Oregon with state advocacy days. And finally, this is one from Iowa. So what you will note in these few slides, which state has the largest number of advocates? South Carolina. So congratulations. So
they're not that picture, but we're proud of y'all.
So I don't know if there's time for questions, or should I stop, or
let's do questions at the end.
Okay.
Can you remember your questions and come back to that? Okay.
Thank you all so much. It's good to be with you. Have a good time.
Excellent. Let's see. Does it go small? Okay, so I'm just going to share just a couple of, oh, look, I came back. Oh, I'm getting good at this stuff. Let's go here. Did that get big yet? Oh, there it is. Okay, down to this one. Hang on 1 minute. Sheesh, sorry about that. So I'm going to take 2 seconds. If you guys can look at this slide right here. Is that working? Yep. If you don't see these little dots, and I already know we've got one of my favorite community families living right here in this Newberry land. I want to see these dots filled out. You guys are going to show up at our advocacy, right? I know you will, because you can do it. So if you see this and you're living in one of these counties and you're not filled in, we need you. Honest to goodness, it's not a lot of time. I will tell you everything you need to do. We do quarterly meetings. This is our third quarterly meeting. It is not hard. We will help you. We will pay for everything. So if you're living in any of these that you don't see yourself, we need you to sign up for our advocacy program, or I might just come after you if you don't sign up. Why should I join? Frankly, because I need you. We need you. Your voice is so important, as Nathan said. It's incredible, and we do what we do only because we're all together. And next year, I try to tell people this. I get a lot of policy stuff come down, and you know how, as a parent, you don't always tell everybody everything because it's like, oh, I don't want to tell everybody that until I need to, right? You kind of keep it in with your children or whatever, especially things. There's a lot of stuff happening. I'm affected. I worry about all of you. You're my family. You are my family. So if I'm hearing something, I'm getting nervous, then I go, uh-oh, how's that going to affect my family? You are my family. And if I'm telling you you need to be a part of this, that I'm being serious. I want to make sure that we continue to have access to care and that we continue to have things that we need. Shelley just told me a little issue this morning. I said, oh my God, we're not going down that road. So things do happen. I just want to finalize with, we've had 11 years of state advocacy days with over 500 legislative meetings. This right here, many of you, I don't know if our people that are watching, is Brandy Stewart. She was before me as one of the presidents for a long, long time. This is our representative still in Tommy Stringer, still at the Capitol. He has a son with hemophilia, severe hemophilia, and we started our state days with them. This little picture up in the corner, you can see Representative Stringer there. However, our Attorney General, Alan Wilson, who's still our Attorney General, came here and educated all of our kids. These are my two little sons, and my third son. These guys were all in high school. They're now over 30. So you can see that we've been a part of the state for a long time. We've had over 100 proclamations dating all the way back. I've got a little book out there if you guys want to scroll through it from 2001, our Hemophilia Awareness Days with Governor Jim Hodges. I didn't even live here. This was the work of Brandy and the team. Some of the things that we worry about or that we look for and that we'll be working with this year in our state days is our proviso. Proviso is like a line, and hopefully I'm saying this, it's a line item budget where there's money appropriated in the state of South Carolina for us. This line item is our Hemophilia Assistance Program. Many of you may be already a part of that. They have changed leadership, and so this is why we build these strong, strong partnerships. I'm happy to say the leadership that's come up is one that we've also been a part of. So we want to make sure that that program stays. So that's why we have some strong relationships. As Nathan said, the Medicaid pharmacy benefits manager, I check in with him about twice a year. And I say, hey, we're still good, right? No PDLs, right? You still got us, right? I will tell you, to be honest with you, we have been told at the state agencies, they don't want to mess with us. We're kind of strong. So it's like, if they don't have to, they don't want to hear from us because they know the second they start doing stuff, we're going to be marching down there. I'm going to be calling all you guys. I'm going to say, hey, we need to go because this is not okay with us. So, but we need to make sure that we have good partnerships and not that we're just bullies. We're just partnerships explaining everything. Our HCC coverage, I'm happy to say that we now have, through the work of Robin and Dr. Ambrose, we now have Prisma Health at Greenville area is now an HCC, a satellite office of that, and Robin has been working strong with Dr. Ambrose to have another satellite office, and we're going to kind of compare our data, not our data, but our databases of where the best place is for down in the low country to get those of you in the low country that are not seeing Dr. Bergman, maybe on the other side, to also have that treatment center. Dr. Bergman has worked so hard trying with MUSC. We'll get there one day because if you're being seen by one of those treatment centers, you need to be in the network, and we want to make sure that that happens. So we're really pleased with that. As Jeremy's going to talk a little bit about our rare disease council, we're really proud of that. We need to make sure that that proviso, that budget money, actually, we need to make it a bill so that that budget money we don't have to look at every single year. And then, of course, we have continued insurance threats. Like I said, I hope Shelley's going to share something. We get a few minutes. The accumulator adjuster, we talked about that last year at Legislative Day, so they've already kind of heard about that. Our biggest thing is just like Shelley, I'm going to pick on her in a minute. She had just said, hey, yeah, guess what I got a call for? If you don't tell me or somebody, we don't know about it. You don't know you have an accumulator adjuster because you're just kind of going with what people tell you and you're forking out more money or whatever you're doing. You need to call me and say, oh my God, Sue, is this normal? Then I could go, oh boy, that's a problem. Nathan, what is this? And then, we go up the chain and then they'll help us build coalitions to find out what's happening and to ward off some of those things. So if we don't know these stories, guys, we can't do anything. So I'm going to now pass it over to Jeremy. He's going to talk a little bit about some of our accomplishments. Then you're going to hear from our panelists. And the last thing I'm going to do is show an awesome video that Greg did for me. It's about 8 minutes long. We're going to close with that. It is about how we got through our legislative process. And like Nathan said, in Washington, of course, I'm sure it's hard, but even in South Carolina, the things we experience, this is like a view of how you get our Rare Disease Advisory Council from implementation, from the, just being introduced all the way to now halfway through going into the Senate. It is very interesting seeing. If we're not on top of it, guys, stuff just goes away. So it's all yours.
All right. Good morning. So, real quickly, the phone to action, if you're not familiar with this, you don't have to be an ambassador to participate in this. This is just a program that NHF, they pay for the access to it so the chapters can, it's very similar to, if you ever get, sign this petition, participate in this campaign, it's very simple. You go onto a form and you put in your address, and it generates who your state rep and state senator is, and then you can send them a personalized email. We've used that, I think, 5 times this year, including a push to get the budget through the governor's office. We sent like 65 emails in a matter of 3 hours, which prompted a call to our office saying, we get the message, but hats off to all of you who have participated, because that's what ensured that we got that done. So on the, just while I'm thinking about it, so the RDAC, before I go on, there is a sign-up sheet so you can receive text. We only did 5 campaigns this year. You're not going to be getting texts from us all the time. We sent 5 texts out. We also send it out through email, so keep an eye out for that. And thanks to NHF it's a great tool, and it's been vital to our success this year. So the RDAC bill, so just to clear up a little, if there's any confusion, there's a budget item that the governor signed to fund an RDAC in the state, which is being in the initial formation stages. But like Sue said, we have a bill that was passed in the House after crossover day, which just means that the Senate couldn't take it up this year, but they can immediately take it up next year. It's in the Medical Affairs Committee. Do I just click to advance the slide? So we wanted to put this up here. This is hugely important committee in the Senate. It's where the RDAC bill is currently assigned. If you live in any of these areas, there's a lot of them, consider participating in the ambassadors program, because this is going to be one of our pushes next session to get a bill that establishes a permanent RDAC in the state. And if you don't live in any of these areas, it's still important. We want to cast a wider net. We want to have reaching out to as many legislators as possible. You never know who's going to be the voice. In fact, the video you're going to watch, there's this great scene in the subcommittee where a legislator that I don't know well, I don't think we have engaged with her in the past, but she says, I don't really know much about, she's the one person that speaks up in the subcommittee and says, I don't know much about hemophilia, but I know it can be a serious disease, and I think this is important. Think about how much more impactful that person could be if they know you know your family. Crystal and Nathan both hit the nail on the head. It's about telling your story, and everybody's an expert in the room in doing that. You don't have to be a policy expert. You don't have to know all the nuances of the legislative process. Your voice, you're an expert on your own story and advocating for you and your family. Yeah, please. I'm sorry. How do I go back?
The Senate chair.
I thought you could do arrows, but... Oh, there we go. Right. I think that's the Baird family, yeah.
Right here.
We will need you desperately if we're going to get a bill, we're going to pass that through. He is the state, he's the chairman of that committee. And I know you guys have relationships with him. So they need to hear from you. And so we will rely on you to do some letters or whatever, but you are critical as well as everybody else. So if you get to the chairman, my understanding is a lot, he has a lot of pull to get some things through. So be thinking about that, and we will help you air and stuff otherwise. We need to show you.
Exactly. So now I think we want to get back to conversation about why we advocate, why it's important for you to consider joining. And I think one of the best ways to kick it off is we have our Ambassador of the Year, Susie Malloy, a well-deserved recognition. She's got a great story about why she advocates and sort of, if you're one of those people that have concerns, again, about, am I an expert, am I qualified? Even I've heard, people say things like, I don't want to make things worse. Hearing these stories up here, you'll recognize that's an unfounded fear that you can do what they're doing, but we appreciate all they do, and I'm going to turn it over to Susie and let her tell you about why she advocates.
want to say good evening to everyone, or good evening, well, anyway, good afternoon. And it says, thank you, Sue, for having me and my beautiful award for Advocate of the Year. My name is Susie Malloy, and we live in Somerville, South Carolina. When I was a child, I had two brothers who died as infants because of their bleeding disorders. One was 1 and the other was 2. Today, we have a son with severe hemophilia B and, and 2 grandsons with the same bleeding disorder. Our son almost died because of a bleed that pooled in his stomach to the size of a football. Thankfully, because of medical advances that have been made over the last 70 years, this saved our son and helped him and my grandsons live a mostly normal life today. This did not happen by accident, but because of people like you who advocated for people with bleeding disorders, things got better. This is not a huge community like cancer or heart disease. Most people are not affected or unaware that bleeding disorders even exist. By speaking up to teachers at schools or educating political representatives at the Capitol about our needs, we increase awareness and help to channel resources to our community. What is an advocate, and why would you want to be one? Simply, an advocate is a person who speaks out or promotes a cause for another. As members of the bleeding disorder community, we all know well the challenges that we and our loved ones face. We have physical, emotional, and financial issues. Some of these can be almost overwhelming at times, other times just inconvenient. There is a broad spectrum of challenges for members of this community. But what we all have in common is everyone needs help at some time, and that's why we advocate. Please don't feel intimidated in being an advocate. Your help can be as simple as attending a dinner to learn more about hemophilia so we can help those affected. Or a much more direct approach, like going to the Capitol to have a representative hear your story. I know this may sound scary, but no worries. Sue will help you or get you the help to make you more comfortable. I am no great speaker or the most knowledgeable, but Sue or her helpers help me find my voice and advocate for this community. Remember, every little bit can help. We all have a story to tell. Thank you.
She's ambassador here. Oh, that was beautifully said. And that didn't come easy. That was not Susie several years ago. So this is all of you. You have it within you. We just need to find a way to bring it out. Thank you. That was beautiful. Man, we could have put you in Congress. Well, she's been there too, but God, you've come a long way. Thank you.
And Susie's been so successful doing that. I think she wins the award for most Zoom meetings in a day and in a week between Washington days and our advocacy day. She was there for everyone and ready to go, and it was great. So we also have Ursula Saget with us this morning, and she has a story about also overcoming an obstacle for her voice to be heard in her community. Oh, let me give you this.
Buenos días, mi nombre es Úrsula Sagot, soy de Costa Rica y estoy sumamente agradecida por estar hoy aquí porque me he sentido como en familia. And I have a big question for you guys. So what do you think about it? Well, that's what I feel 6 years ago when we moved to the United States. I feel so scared, frustrated, alone, and right now, I feel like this is my family. I have 3 kids. I have Miranda, she has von Willebrand. And I feel so blessed to found Sue that day in the hospital and Robin, because they're very patient with me because my English is not the best. But we try every day. We try to understand the doctors, teachers, and every person outside. They try to talk to me, and sometimes it's hard. It's really hard. But I'm here, and that's what I want to work so hard to help another people with bleeding disorders outside. Maybe they have the same fears that I have when we move, to talk to people outside or with doctors or the hospitals, because like I said, like me, I'm so scared to try to understand everything, and maybe sometimes I don't understand what I said, like about the medical conditions, medications, insurance, and everything. But I want to help everybody outside and help they know everything's going to be okay. And I really appreciate the time in the United States and help my daughter with a bleeding disorder. And whatever you need, just let me know. I'm here. And if you know people, they don't speak English, just let me know and I can help a little bit. Thank you.
And I want to say one other little thing. So I didn't know, we never know what another person feels, right? I came up upon Ursula, and there was Norberto. And they're talking, they're Spanish, and they're going away, and they're having a good conversation. I'm just standing there like, what are they talking about? I finally felt what it was like to not understand language, or to not understand what another person is feeling if they don't understand, and trying to get along. So she is a part of our board of directors. She is here for Hispanic and anybody to make sure that you're comfortable. I felt, my God, we did do something right here. So I'm so proud of you and your family, and I thank you from the bottom of our heart for bringing the voice out for our Hispanic family and finding those members in South Carolina, because they are here. We need to bring them in, and I know that we've got them with our other great family in Newberry. So thank you all for being here. And Rolando, we love you, honey.
Thanks so much for sharing that. We're going to move quickly to our next advocate, Christine Evans, and she's got a great story to tell about why she advocates. Has been doing it for a long time, and has been a long time member of BDASC. Thanks for sharing.
Hello, everybody. My name is Christine. I'm mother to Bradley Odak. Bradley is a member of this family more than he's a member of my family. We came here 12, 13 years ago, and the first family we really met was Hemophilia, South Carolina. Bradley now is a graduate from College of Charleston after so many obstacles. I didn't know we'd get here, but we did. Back at home, we didn't have any kind of medical assistance. We didn't have... A few people knew about hemophilia, and he had a lot of traumatic knee injuries. We came in here in a wheelchair, and today Bradley is one of the best dancers that I know. I'm really proud of Hemophilia South Carolina. They helped me and Bradley go through college. Robin, I don't know what I would have done without you. Sue, I don't know what I would have done without you. Just knowing that these two were there for me helped the journey very easy. I was talking to somebody yesterday from home, and they asked me, how is Bradley? I said, really? I have nothing to say. He says, does he still go to hospital? I said, since I came to the States, he's been to the hospital once. And they didn't believe it, because we lived in the hospital all the time. It financially broke us down, emotionally broke us down. And just finding this family was a good thing. So why am I an advocate? This is a question we asked Bradley one time during dinner, and we said, do you ever regret having hemophilia? And the answer tore me down. He said, every day. And that's an answer that every hemophilic carries with them every day. That's how they feel every day. Do we want to help them every day? I don't think we're doing enough to help them overcome this feeling. It's not going to be 100%, but we can go out there and help them out. Right now he's out. He really doesn't have a job per se. Every time he's applying, the first question is healthcare. You know, I need a job with good healthcare because of the co-payment. We know how South Carolina is. He's thinking of moving out of South Carolina. But again, the question is where? He feels safe here. This is home. He knows there are people for him. But how about health care? We had a meeting the other day, Sue and James and a few of us were there, and of course I had to pay him to even leave the house to go for that meeting. And James, thank you so much for what you did. James, talked to him, and I see it's making an impact, and I don't know again what I would do without you people, and thank you for bringing him up with me. And that's why I'm saying advocacy is important. Advocacy involves people. So we will need your help. Every hemophilic in this house in South Carolina needs your help. We need to go out there and tell people what we feel, what our young adults feel, and how we can help. We don't have the financial capability, but it's out there. It's just waiting for us. So for all the Bradleys in the house, I know what you feel. I know it's hemophilia for you every day. I don't feel like that every day. I'm just a mother. I have other issues. But my prayer for you today is to help these children feel a little bit more comfortable from the everyday feeling of having hemophilia, because that's the feeling of every hemophilic in the world. Thank you so much.
Thank you. That was great. That was great. Before we run out of time, I want to. Sorry, I'm moving so quickly between panelists, but I want to give them the most time possible. So our last two are, I think, two of our longest serving advocates. The Keith family, I think they're at every advocacy days. He's been doing it for a long time, Mr. Ward Keith. And what I love about it, he just became an ambassador. And, you know, it's not exclusively, but a lot of times ambassadors are, we're trying to galvanize, we're trying to motivate people to get involved. And Mr. Keith doesn't need any motivation. He's at everything. He's dedicated, but I just love that he wants to find any way he can to support this community. And I'm sure you'll love hearing from him.
Can everybody hear me? That's fine. I think for me is the thing that I think about is, you know, we said this word a lot, concern. And I think that, you know, each one of us, you know, feel like we wish someone would have a concern for us. So for me, going for myself, you know, just letting everyone know that, you know, this is what's going on with me. This is what I need. Could you help me? And if I would go, and then one of you guys would go, we all would show a concern for the other person, saying that, you know, that, man, this person really cares about me. So, you know, that's my reason. And I think that you know, as it's going to take time, because like we don't know all the ins and outs. But what we can do is continue to go and tell people, this is my concern, this is my concern. And the more they hear that, you know, people will listen and say, you know, this person is really concerned about the next person. What can I do, you know, to make it better? And so I just hope that everyone will look at it that way of saying, okay, how can I be kind to the next person by advocating? You know, how can I show my concern? How can I encourage them that I know this Eugene disorder is difficult, but you know, I'm here to help anywhere that I can, and hope that motivates them to get through each day.
And our final panelist is, I think everyone knows, April Baird. She's a longtime advocate, and I think a great way to cap things off, just talking about why we should day in and day out, year in and year out, advocate, because things can change, and I look forward to hearing from her.
My name is April. We are from April Baird. Our family is from Clinton. My dad had hemophilia, and of course he had 4 girls, and all of us have children who have hemophilia. We just always was involved in everything in hemophilia. That's just the way Daddy had always taught us. I remember sometimes I went down there and told Sue that I felt like I was wasting everybody's time because I was there and I did not have any issues. I had great insurance. My husband had great insurance. Everything was just wonderful. I really didn't understand why I was advocating. But today, I did get a lot of relationships with people, and Danny Burden is one of them, who told me and my sister that if there was ever anything he needed, ever anything at all we needed, all we had to do was ask. So, obviously, it is going to be a big ask, and I will remind him exactly what he told me 2 years ago, and I will remind him every time I go into his business, because we also do business with him. With all that being said, this year is a big difference, because from now on, when I go there, I will be advocating on my family's behalf, because we had never had anything. I was always advocating on everybody else. This year, my husband had some major health issues. Long story short, he wound up losing his job and will probably not be able to go back to work. I work for a small business, and they could not offer insurance. So as of next week, I'm working my final week at my job, where I will be moving to another one just because of insurance issues. So now I'm advocating on my own self. But I feel like I'm in a better position to advocate on my own self because I already have relationships with every one of these people. So all these years I went down there and said, just thank you for continuing what you already do. Now I'm going to go down there and say, okay, I need your help. And that's exactly what each and every one of you can do.
Good job.
That's great. That's great. And thanks to all the panelists. I hope their stories inspired you to get involved, and you can be up here with us and in the State House telling your story. One quick thing about the video, and I'll turn it back over to Sue. So I don't think I mentioned that we had 30 Zoom meetings this year, maybe more like 35, including phone calls and other things that fell through. But it was a testament to people are juggling work schedules, and that's on par with what we do in person. And it was also a learning experience. Zoom, we're gonna keep using Zoom to engage legislators even outside the legislative session. And then I think that's it. Yeah.
All right, so I know we're running a little late. If somebody needs to use the restroom or stand up or whatever, feel free. But I'm going to go ahead and show this video. We still do need to stay on task, and at 11 o'clock head off and go our way. But on top of that, before we start that, thank you to each and every one of you. Thank you to each and every one of you advocates. Every time you make me cry. Thank you, Nathan, for teaching us and giving me the courage to ask and just ask and just ask. And you guys are just simply the best. So I'm going to show you what it's like. Again, it's pretty interesting to see what happens in and this is South Carolina, our legislative body. And then, feel free to go. And I appreciate that. Shelley, we're going to have to come back to you on what happened maybe at lunchtime, but I do want you to hear about Shelley's, and we can answer any questions, all right? And thanks, Greg, for doing this.
Mr. Howard, South Carolina Rare Disease Advisory Council.
Refer to House 3M committee.
The council will solicit comments from the public to survey needs of rare disease patients, caregivers, and providers. Before we acknowledge any of our speakers, any members of the subcommittee, I know you've had a chance to review the materials. Do you have any discussion before we go to any of the speakers?
Just make a comment.
Yes, ma'am, Ms. Brawley.
Thank you, Mr. Chairman. I just want to say that this is something that you would have thought we already had in South Carolina. And given the number of just the agencies that have an interest in this and making certain that these rare diseases are well known to the people who are treating these patients. I think it's a really good thing for us to try to pull people together in a room to try to figure out how best to offer care. So I want to just commend you. I don't know anyone who has hemophilia, but I do know that it is a very serious life-threatening disease.
So she was talking, we had a letter with every
Folks on Teams, are they ready? They're ready? Okay, great.
to them, including NHF, HFA.
Thank you. Thank you for the opportunity to provide oral testimony to the Health and Environmental Affairs Subcommittee today. My name is Suzanne Martin. I live in Greenville County, and I'm the Executive Director of Hemophilia South Carolina, the state's only nonprofit advocacy organization that represents individuals and families who are diagnosed with bleeding disorders. More importantly, however, I'm a mother of 5 children, 3 who live with hemophilia, an inherited genetic bleeding disorder in which the blood is unable to make a proper clot. Without medical treatment, uncontrolled bleeding can lead to debilitating damage. And
through enacting a rare disease advisory council in the state of South Carolina, it would provide an outlet for the rare community to be heard. The RDAC would address various issues that the rare community faces, and it would provide support in improving their healthcare needs.
Representative Bustos.
Thank you, Mr. Chairman. My only question is, does the medical community have anything like this?
I'm sorry, is your question specific to the medical community in South Carolina?
Well, I guess it's the medical community at large. It would seem that they have a vested interest in rare diseases and should have something like this, and they don't, I'm assuming?
Right, not to our knowledge. And, you know, this council would include representation from the medical community, like our doctors, nurses, etc.
Okay, thank you.
Thank you.
Yeah, if you're ready for a motion, I'd make a motion that we, Mr. Chairman, if you're ready to accept motions, I'd make a motion that we recommend to the full committee approval of this.
And there was a motion by Representative Bustos. Did I hear a second? Moved and properly second that we approve H3956 to the full committee. Madam Clerk, if you will call the roll.
Ms. Brawley? Mr. Bustos?
Aye.
Mr. Hart? Aye. Mr. Johnson? Aye. Ms. Matthews? Aye. And Mr. Howard?
Aye.
All right, it's unanimous.
H396 has been favorably approved to the full committee, and that adjourns our committee for today. Thank you all for your hard work and your great South Carolinians. Thank you. This bill establishes the South Carolina Rare Disease Advisory Council within DHEC. The purpose of the council is to advise the General Assembly and state agencies about the needs of individuals with rare diseases living in the state. The council will survey the needs of rare disease patients, caregivers, and providers. It will publish a web-based listing existing resource on research, diagnosis, treatment, and education relating to rare diseases. Also distribute educational resources for healthcare providers and identify best practices to reduce healthcare disparities and achieve healthcare equity in the research, diagnosis, and treatment of rare diseases. Council members will serve without compensation and are ineligible for mileage, subsistence, or per diem. That is the extent of the report.
Thank you. Is there a federal agency that studies and adopts policies related to rare diseases?
I would be willing to go out and say yes, the Center for Disease Control.
Does this cover any gaps within the federal system, or how would this be different?
I'm not sure about any gaps. I know for South Carolina in specific, this is an issue that we want to take up to make sure that our citizens were taken care of, especially some of the rural populations and low income who don't have the readily and immediate access to health care.
Of in favor, 4 opposed. Question is adoption, House Bill 3956. Roll call is required. Voting on the board's order.
This is very interesting to watch. This is how they vote, and you could watch your representative vote. But if you'll watch what's going to come up next, see a lot of greens, and then all of a sudden a green goes to a red. What? What? You changed your vote on what was on the board? Why? Why would they do that? Well, they would do that maybe because their party, I'm not sure. Watch this. This was a surprise to us as well. I don't know if you can see it, but they did change from green to red. And those votes counted. We didn't pass unanimously on this. We only passed 40-something. And Jeremy will tell you his switch votes, and he'll tell you at lunchtime.
Time has expired. Clerk, close polls, tabulate. Vote of 6345, 3956 receives second reading. Mr. Hart moves we do now.
Funny. So we learned a lot. We learned a lot through this process. It was so eye-opening, and it also let us know that, boy, we can't do this alone. Every voice counts. So thank you all for being here. You got exactly 10 minutes. I appreciate you hanging in here, but I assure you, you can do this in a heartbeat very easily, and we'll be calling on you. So the sign-up sheet is right there. Greg's standing it. Just go ahead and sign, and we'll add you to the email list. And these guys are around to ask any questions if you want. So thank you so much.